So I have the delightful project or goal of trying to discuss with you the future of families after COVID-19. This is intended to be more of a discussion or just putting ideas out there, kind of preliminary thoughts, because of course we don't exactly know what's going to happen with families after COVID-19. So this talk is going to focus a bit more on partnership formation and fertility decision-making. It follows up really well with Lydia and Brian's discussion or presentations. And indeed, they have really provided a very good introduction to what I'm going to talk about. So as we know, COVID-19 has had a myriad of impacts that could impact people's decision-making processes. First of all, health concerns. So many women may be very reluctant to become pregnant during the pandemic, and that might lead to the postponement of fertility. Also, of course, there's been this lack of social activity, opportunities to meet new partners. It will be very interesting to see how many people put their partnership formation on hold, what happens with dating, and whether or not people moved in together more rapidly, all of these different types of impacts of lockdown. We've had different presentations over the week that talk about the increased care responsibilities, especially for women. This is obvious, it's been in the news quite a lot. And that can be changing people's decision-making processes around having children. If this impact on women goes on for quite a while, it could lead to lower employment rates for women. That may then change their mind about having maybe second or third children. So that aspect of it is really, really important. But really what I want to talk about is what has already been talked about, which is that this pandemic is going to lead to economic uncertainty and general uncertainty for the future. So Brian really laid this out very clearly. I think one area which we know a lot about is how economic uncertainty from the Great Recession of 2008 has led to changes in family formation. So that's what I want to talk about the most. Another aspect that I'd like to talk about is how it's exacerbated inequalities. And the previous presentations have really shown this very clearly with the pre-COVID situation. And recent COVID studies have really highlighted how inequalities have been exacerbated during this period. So you can see here this changes in household earnings this is from a policy brief from the very first Understanding Society COVID survey. And you can see how all income quintiles had loss in household earnings, but the percent change varied by income quintile. So the people in the highest income brackets lost on average, about 8%, but for the lowest income quintiles, it was closer to 20%. So it just has had a much stronger impact on those within the lowest income quintiles. The IFS Deaton review came out just recently, and they highlighted 3 areas of inequality. The first was income inequality, as has been seen in many studies. They also talked about socioeconomic inequalities in education and skills, and this ties back to Lydia's presentation, because if young people aren't able to attain the education and skills that they need, then that might end up with more job insecurity and precarious positions, which then may impact their expectations for moving in together for marriage and for having children. And then finally, I think Brian also talked about the intergenerational inequalities, how it's the young people who are really being impacted by this pandemic. And this will have a long-term effect on their future wage opportunities, growth, employment opportunities into the future. So let's go on now to marriage and fertility. So we know, of course, that there's been this postponement or this halt to all weddings. And some people are rather optimistic that there's going to be a wedding boom once then you start to open up again. I mean, you see here in the BBC a couple of days ago, there was this discussion about how wedding venues are booked up for 2 years. So we might see a period impact of weddings or marriage, official marriage, and we might see them in 2021. There was practically no weddings, but then we see this boom in 2022 and 2023. That could possibly happen. I'm doubtful. I think that really what has happened is that the majority of people have postponed their weddings indefinitely or even possibly abandoned the idea of having a wedding, especially given the changes in their finances. I've done focus group research with Anne Barrington in Southampton, and we found that people just postpone their weddings or their marriages because they have other priorities. They want to focus on paying for raising their children, or they want to have invest in housing. So people can very easily postpone these wedding plans, and I think that that's much more likely to happen. Also, a lot of previous research has found that economic uncertainty leads to the postponement of marriage in favor of cohabitation, which is very well suited to uncertainty. Cohabitation in focus groups and in other types of research is seen as a less permanent relationship. It's less committed, it's easier to get out of. It really fits well to this economic uncertainty. And we've termed this the pattern of disadvantage, where marriage is increasingly more likely among those with higher income and education, and childbearing within cohabitation is more likely to occur among the disadvantaged. So we have seen the COVID-19 uncertainty could result in several different avenues of behavior. Some people clearly moved in together much more quickly. And if we get the data, we can see whether or not LATs turned into co-residential relationships more quickly. Others may not have survived the lockdown period, and there could have been an increase in separation. Now, I've just seen that divorce data has declined in the UK, divorces have declined in the UK. People don't have anywhere to move right now, but we might see a divorce boom after the lockdown as well, or at least a separation boom. But my guess is that it's going to be a lot of the informal cohabiting relationships which are likely to separate, and we won't see that in the official divorce data. There have been some official studies with surveys that asked people about their economic uncertain conditions and whether or not they're going to postpone marriage, like this one in April in Italy. And they found a strong association that it's the people who are in more uncertain conditions who are more likely to postpone marriage. So in the long term, is this going to lead to an increase in singlehood and long-term cohabitation? That remains to be seen. So moving on to fertility. There could be a baby boom or a baby bust. You might have seen in the news that there were 6 pregnant women on one street in Bristol during lockdown, and they interviewed them and said that this was, lockdown was a really good time to reestablish their relationship, think about their family priorities, and go on and start family formation. And indeed, if you think about Shee's presentation, where 20% of relationships people reported an improvement in their relationships, it makes sense that people might find this a good time to have a child. But again, we don't think so on average, we being the demographic community. And there has been a long-term trend since about 2012 in fertility decline in the UK, and most of us think that this is going to continue over time. So we know that there were already fewer births in the UK in 2020 up until September. The TFR was around 1.6. This is the lowest since about the 1970s. So it's very likely that this trend is going to continue. We have other surveys which have shown that uncertainty is leading to the postponement of childbearing plans. There was one really quick rapid survey in, I think, April or May, that found in Germany, France, and UK, most people are still planning or postponing their childbearing. In other countries like Italy and Spain, they're just stopping their childbearing plans altogether. And in the UK, they found that economic uncertainty was associated with abandoning or postponing these childbearing plans. So already some early evidence that this is happening. And my colleagues at the University of Southampton and St. Andrews just recently, just today, I think it was, published this working paper which shows scenarios of fertility in the UK for the next years. And they say that there could be this baby boom, but it was only 1 out of 4 of the scenarios. The other 3 scenarios showed that the decline in fertility was going to continue, and there would be a downward trend, or that there would be even a further baby bust as a result of the pandemic. So we have big questions for researchers. I think one of the interesting things from a demographic perspective is whether or not this is a temporary period effect. Will we see the recuperation occur in 2022 or 23? Or does this represent, say, an inflection point in family formation or a continuation of downward trends? The UK has had this decline in fertility over the past, say, 5 years or so, but other countries which also had replacement level fertility have also experienced these declines in fertility, which has surprised many in the demographic community. So the US had a decline in fertility after the Great Recession, and recently the Nordic countries, Norway, Sweden, Finland, they have all reported declines in fertility before COVID hit. So many people are starting to wonder what's happening. In the Southern European countries, fertility has gone back down to very low levels. So the Great Recession of 2008 had a kind of delayed impact, but this uncertainty is definitely leading to fertility declines around Europe, and we think that COVID will make it even worse. We don't know which areas will change the most. There's marriage and cohabitation or partnership formation. I would expect an increase in childbearing and cohabitation. I've talked about fertility. Gender relations, I think, will continue to have an enduring impact on people's decisions to have children and marry. So the other issue that is probably going to happen is that these trends will be exacerbated, and there will be this continuation of the pattern of disadvantage, or as Sarah McClanahan called it, these diverging destinies. And you'll see that those people who coped relatively well with the pandemic, who were able to work remotely, who were able to combine work and family better, they are the ones who are more likely to go on to have the second and third children. And we would expect that the low-income couples are more likely to have their births within cohabitation, but it could be that they also start to have fewer children over time, and maybe an increase in childlessness, which would reverse long-term trends. We've seen this in, say, Finland, where it's the lowest educated men in particular who are more likely to be childless, and these trends could continue on elsewhere. So unfortunately, from a demographic perspective, things look pretty bleak, but we never know what's going to happen, and we'll have to see whether or not there's a real recovery later on. So Understanding Society is going to be a very useful resource for studying the long-term impacts of the pandemic. We've already seen several presentations which are really exploiting the longitudinal nature of the data and seeing how these trends change over time. So we're very, very lucky to have this 10 years of data and plans to have the data collected into the future. So please continue to use the data set and spread the word and disseminate your findings. And I look forward to hearing from all of you again about what you find out in the next couple of years. All right, that's it. Thank you very much.